Hi, Kevin Henry with Dental Economics. I'm here today on a Skype interview with Nancy Drew. She is an international sales expert. She's an author. She's a speaker based in San Diego. And we're going to talk a little bit today about the 3 biggest ways to instantly increase your revenue and patient satisfaction. So Nancy, first of all, thank you for your time. I appreciate you being here.
Well, it's an honor. Thank you for contacting us.
Well, tell me a little bit about some of the 3 biggest ways that you feel like dentists can, and obviously, increase their revenue and patient satisfaction.
Well, it's pretty easy. It's pretty easy. It doesn't take a lot of work or a lot of expense. It doesn't mean getting a big team of people in.
Okay.
These are things that you can do. But to be honest, the dental community is one of our largest clients.
Oh.
And I think the reason is that historically they haven't really thought of themselves as a sales entity, if you will. But nowadays, with Groupon and all these specials, dentistry and medical services are becoming a lot more commodity. So we need to actually get out there and educate our patients and get them into services because somebody else is just waiting to take them. So the 3 things are, first of all, one of the biggest things that we've done, and we track the results on it, and the 3 things led to results of this: 200% increase in service bookings and 58% increase in retail sales. So that's significant, and this is how. So one of the things that we did was a very proactive consult form. So we work that with the offices that we work with. We go in, we take a look at their forms, and people have pretty standard but different things that they're going on. And some offices want to promote specific services, some don't, so we really need to rewrite that consult form so that it is helping the patient not just take history, but it's helping them see what they can have, what that looks like. And also we work with them to get leverage on the patient so the patient doesn't put it off any longer. Because a lot of times the doctor will suggest, well, this is the way we should go, and the patient doesn't follow up. They're like, yep, that sounds like a great idea, but they don't do anything. So the consult form is developed in a way where it's not salesy, it's not aggressive, but it really does plan out the treatment plan. It involves the patient. They get leverage on themselves. They're now ready to do it. We take it another step forward into payment options if they need to. And as a result of this, we put them on to basically a 6-month scheduled appointment. And at some points in some offices, they actually take payments monthly and they're in the system.
Okay.
So that's one.
Okay, great.
Yeah. We, because this is a very touchy area, you need to be very, very careful with, not looking like you're just a cash funnel trying to get people in and take their money. We need to be very sensitive to that.
Absolutely.
So what we've done with these measures is we've done the customer satisfaction surveys to the patients to make sure that this is, the money is coming in, and that's a great thing, but we also have to make sure that they're not feeling that they've been pressured or the office is suddenly has a different agenda.
I understand.
And the satisfaction scores have been very, very good. It's so much so that the practices continue on with the movement, and they're now implementing other things.
And I know one of the things that you emphasize is that doctors really shouldn't give up on the patients who have, quote, left the practice. They shouldn't just give up on that, right?
That's correct. That would be another,
Okay.
that a lot of the patients that may not be with you any longer, they may have left, the grass may have looked greener at the time somewhere else, but then when they get there, it's not really such a great thing, And the stats show that past patients that have left and are not working with you any longer, will rework with you once you contact them at a ratio of 5 to 1.
Oh, okay.
So to get a new patient, somebody into your practice, that's a ratio of 25 to 1.
Wow. Okay.
And, so you need to realize that even though you may not love me anymore, it doesn't mean that you're not waiting for my call.
Understandable.
So if you reach out and contact them and give them a reason to come back. We have had really great success with promos that we've done. That is actually, here's a tip that's not part of this, but direct mail is getting unbelievable results right now because people are inundated with email.
Sure.
So direct mail is kind of leading the pack because people actually take that out of their mailbox and they look at it, they hold it. It's actually being seen instead of hit the delete button. So we've done some promos with direct mail to that base, and then we follow it up with a phone call. We have kind of a plan that we set out with our clients, and bringing those people in, offering them something, and bringing them back in has had a very good success ratio. Definitely, the return on investment has been significant.
Good to know. Absolutely.
Yeah. So don't discard those old patients. They'll come back. Some of them.
And the last point I want to talk to you about is I know you're also saying pre-planning your appointments is a very important thing.
It's huge.
Okay.
It's huge. Yeah. Historically, before my sales career, which has been very long, I worked in the medical community. The medical and dental areas, and when you have that patient load, it's a busy day. You've got your chart, you've got your appointments, and you are knocking through, and you're trying to get one person into an office, care for them, get them out, and have that whole process flow. And historically, there really hasn't been a lot of sitting down, looking at the charts, and pre-planning what is really the A game for this patient. Now, in the general sales arena, we're sales trainers and sales coaching. We do a lot of this work with professional salespeople of what's the goal for this meeting, what is an alternative for this person, what do they want to see, what problems are they having, what do you solve, those kinds of things. There's a lot of pre-planning that goes into that, but in the dentist area, they can pre-plan, and this is what we've been doing, is sitting down and looking at these patient charts and saying, Anne has been my patient for 7 years, and sometimes when Anne comes in, we chat about her kids or her holiday, and I do what she's booked to come in and do. But maybe Anne doesn't know about all the other services that are available to her that could really make a difference, because we're in the business. Our clients, our patients, they don't know what we know.
Right.
And sometimes that delivery of saying, Anne, this would be so amazing for you if we did this, and she'd book and come on in. So we had seen doing that, pre-planning and taking the time that this is really the best thing for this patient, and not prejudging that they wouldn't do it. Because that's what happens is, they're not interested. Just give them the opportunity.
Well, Nancy, tell our viewers where they can get a hold of you if they need some more information or would like to contact you about some of the points you talked about today.
Yeah, well, we would be thrilled with that. We do a 30-minute strategy session that's absolutely complimentary, and that gives us a great idea of what it is that our clients or prospective clients are trying to do, if we're a fit, because we're not a fit for everyone, so you need to find somebody that fits with you. And anybody that's looking at that can contact us on our website, and that is www.drew, D-R-E, and the word and, associates.com. There's a contact us page, and they can go through our office and schedule that. Plus, on our webpage on the blog, there's all kinds of free information, do-it-yourself information, just like we've been talking about. There's videos, there's templates, there's all kinds of information there. So I look forward to that.
Well, Nancy, I really appreciate your time. Thank you so much.
My pleasure. Thank you.